What is a macular hole? Well, a macular hole is a hole in the central part of the retina, known as the macula, which we use for fine formed vision, so detailed vision. And the patient may notice that there is a dark spot in the centre of the vision and that particular aspect, for example, when they're reading, it is missing. The hole occurs probably due to scar tissue forming on the surface of the retina, a bit like a piece of cling film which crinkles up. As it pulls on the retina, it pulls a hole in the retina and produces the defect. It may be confused in terms of symptoms with, for example, macular degeneration, or occasionally cataract because the vision is blurred. If the hole is full thickness, it's possible to carry out an operation to remove the scar tissue, to allow the retina to relax, and the hole to spring, instead of being pulled open, it springs closed, and that results in improvement in vision and improvement in one of the key symptoms, which is distortion of vision. At Grange, this is a procedure which we're very pleased to offer to our patients. If macular holes are left untreated, the vision will gradually deteriorate and there can be a lost opportunity to achieve a good visual outcome. We would expect for 60 to 70% of patients, when the hole closes, that the vision will improve, and probably a higher proportion, 80%, for the distortion to disappear.